Good afternoon. I want to welcome you to the White House and thank you all for your commitment to improving the lives of Americans with sickle cell disease. September is National Sickle Cell Disease Awareness Month, and for the first time since 1983, the White House has elevated this important issue with the presidential proclamation. Today, we are here to support those affected by sickle cell disease and to reinform our goal of finding a cure. Although we have known about this disease for over 100 years, too many Americans living with sickle cell still do not receive the quality care they need and deserve. But together, we can bring help and hope to so many children and families. Children well-being is primary focus of my Be Best initiative. Unfortunately, the effects of sickle cell disease often begin in early childhood and can cause episodes of extraordinary pain that put patients at risk for organ damage or stroke. We have made progress in treating this disease. Early identification and new life-saving therapies can help. The President has signed a bill that funds research and treatment, and the administration has launched a program to provide new training for healthcare workers. But there is still much more to do. Through leadership from HHS and Admiral Garrar, an administration announced funding to increase the use of recommended medication for children. HHS has also partnered with the National Academies of Science, Engineering, and Medicine to publish the strategic plan and blueprint for action to address sickle cell disease in the United States. And today, the Centers of Medicare and Medicaid Services is releasing a new national sickle cell disease infographic that will provide important information to both doctors and patients and improve the quality of care across the country. We are surrounded today by doctors, researchers, advocates, parents, and patients, all united by our belief that a better and healthier future for our children is within our reach. It is an honor to have you here today. Now I would like to ask Jerome Smith from the White House Domestic Policy Council to say a few words.
Thank you so much for your leadership, Mrs. Trump. As the First Lady said, sickle cell disease is a very common disorder. Sickle cell disease is painful, chronic, and inherited disease that afflicts 100,000 Americans, primarily African Americans and Hispanics, and millions around the globe. That is why it is so important that this administration has focused on making actual change and creating policies that improve the lives of the vulnerable. At the direction of the President, we have made huge changes to empower minority communities in many different ways, like by improving infrastructure, creating better economic and workforce opportunities, and addressing health disparities in America. President Trump has also done more for people living with sickle cell disease than any other administration before. The President and First Lady have provided opportunity for children and families in minority communities who have been previously overlooked. Nearly every African American has a family member impacted by this disease. That, of course, includes my family. I have a niece and a cousin who've spent many years in the hospital, and I'm thankful for organizations like Make-A-Wish that's made their hospital stays at least somewhat comfortable. And I'm blessed that they were able to get the transfusions and things they need to be with us today. Data tells us that 1 in 13 African American babies is born with sickle cell trait. They carry the gene for sickle cell disease, and 1 in 365 African American has sickle cell disease. The painful outcomes of sickle cell disease can be minimized with disease-modifying therapies such as hydroxyurea. Initiation of hydroxyurea among pediatric patients has been found to reduce rates of hospitalization, pain encounters, and emergency department visits. It also has been shown to be cost-effective and to reduce total healthcare costs. The new funding demonstration, coupled with other sickle cell disease and minority health initiatives, will continue to improve the lives of all Americans. Thank you all of you here today, sharing your story and raising awareness. We are grateful to be able to discuss the progress that has been made with the White House support and the future innovations we can continue to uncover. Thanks again.
So good afternoon, everyone. Thank you, Mrs. Trump, for hosting this historic roundtable on sickle cell disease. As a pediatrician, as a pediatric intensive care physician, and having Shamanika as almost a member of my family, this is a day that I've really dreamt about for many years. Your personal commitment to support children's needs, and now your presence here today, continues to inspire us. I also want to thank all of you, patients, advocates, docs, all sickle cell warriors and part of our extended family. Our administration made the promise, I made the promise to all of you, that people with sickle cell would never again be last in line. And we have kept that promise. Today's part of that. President Trump was the first president since 1983 to even mention sickle cell from the White House as messages in 2018 and 2019, and now as an official proclamation just this month. He also signed into law, I know many of you worked on that, the Sickle Cell Disease Inheritable Blood Disorders Act of 2018. We started a federal work group under Admiral Collins to bring leaders from all across the government to prioritize sickle cell activities. We started the STAMP program to mentor primary care physicians and practitioners how to take care of people better. We're using digital technology to tell your stories. Under Dr. Gibbons, the NIH began the Cure Sickle Cell Initiative, trying to cure within 5 to 10 years at NIH. Last year, while I was acting FDA commissioner, we gave accelerated approval for 2 revolutionary new highly effective drugs for sickle cell. And as the First Lady mentioned, just this month, after 2 years of work, the National Academies of Sciences, Engineering, and Medicine published a sickle cell disease national action plan that outlines in almost 600 pages the steps we need to do as a nation. And today, as the First Lady announced, we are announcing the first ever national report card on the 41,000 plus Americans with sickle cell disease covered by Medicaid or CHIP, where they are, what treatments they receive, how many times they need emergency care or admitted to the hospital. Unfortunately, and this is data from 2017, less than half of children with sickle cell receive recommended care. But now that we know the data, we can measure it, we can improve it, and we're going to do just that. Finally, our administration is leading a global movement, including the World Bank, health ministers, African First Ladies, to implement large-scale screening and primary care for sickle cell disease in Africa. Through this initiative, we can save the lives of more than 9 million children with sickle cell by the year 2050. Our administration will continue to raise the profile of sickle cell, but more than words, we commit to you to make meaningful progress. Words only go so far. We're going to go and walk the walk. Thank you, Mrs. Trump, for your compassion and using your platform to help these families and families throughout the world. And now what you're really here for is to hear from them. We're going to start. I just met some of these, and some are my family members, but we'll start with Kayla Smith-Owens across the table.
Hello, everyone. Thank you for having me here today. My name is Kayla Smith-Owens, and I have sickle cell disease, hemoglobin SC. I did not experience the effects of sickle cell until I was 11 years old, which is not something that usually happens. But when I did experience the effects, it wasn't as bad as it is now. Now I'm in the hospital almost every month, and I can definitely say that being in college has made it worse because of the stress. I'm a college student, I'm a senior criminal justice major. I have become an advocate for sickle cell. It's something that I feel very strongly about, working to improve the lives of us. I host toy drives for the children at Children's National Medical Center in DC. I speak at different events. But one thing that I feel very strongly about is sickle cell trait. I feel that we need to find a way to make sure that people get tested, because people don't find out that they have the trait until they're already pregnant. And then at that point, if their partner has the trait, there's a 25% chance that their baby could have the disease. And if people knew ahead of time, things could be prevented, and that could prevent us having so many people suffering from this awful disease. I'm very hopeful in the future that we will have more for sickle cell disease, more options for cures, more medications. The one thing with sickle cell is no one in this room that has sickle cell looks as sick as we are. You can't tell. You can't look at me and say, oh, she's sick. Oh, she's in the hospital every month. And even when I come out of the hospital, I actually just came home from the hospital on Sunday, but you can't tell that I was in the hospital. We just really need help with this disease, and I'm really happy that we had this opportunity today. Thank you.
Thank you, Kayla, and Kayla's mom, Michelle.
Hello, my name is Michelle Smith. I'm Kayla's mom. We are really blessed and very excited to be here, to be able to speak about sickle cell and our experience. I'm extremely proud of my daughter. She's been an advocate. She talks about sickle cell whenever she can. She spoke at colleges, but like she said, you look at her and she looks like everything is okay, and she's really good at that. I just sit back and I think about the nights when she can't sleep, when she's in a lot of pain, a lot of the missed opportunities, things she's not able to do because of the pain. And she tries her best not to, let sickle cell hold her back and restrict her from anything, but sometimes, that happens. So, I just try to support her in any way I can. I'm a nurse, so I see it from the parent side where I'm sitting with her in the hospital room. I also see it with my patients, treating my patients, so that does help me, kind of give me a little more understanding of what my patients are going through. But even at that, I could never experience the pain or know, exactly what she's going through. I only know what she's telling me. So sometimes I feel like we're not heard. Sickle cell is not talked about a lot. Like she said, you can't look at her and tell that she has it. So sometimes I think that an opportunity like this is a blessing, for her to be able to speak for sickle cell patients everywhere and explain, what is going on with them. And I'm just praying that, we can come up with a cure. Myself, I'm going to support her and anything that I can do for anyone to advocate for this awful disease the best that I can, Thank you for this opportunity.
Thank you so much, Ms. Smith. And now, I think the star of the show, Samuel, who's a 12-year-old young man who's got a personality as big as the moon. He's a patient at Children's right here. Samuel, the stage is yours, my friend.
Hello, my name is Samuel Price, and I'm 12 years old. The first time I experienced sickle cell was when I was a baby. My grandmother told me that I had a crisis in my hand. When I was 7 years old, that's when I really experienced the pain and I actually felt it. Like, I actually knew about it. I was 7 years old and I had a crisis inside of my legs, and I had to go to the hospital, and I spent a few weeks in the hospital, actually. And it was around Christmas time, and I missed Christmas. I missed Christmas, but I still got presents. Yeah, okay. But then after Christmas, when my birthday came around, my dad, he told me that, he said, do something different. And I said, I'm gonna find a way out. And somehow the next day, I went to my mother's house, and we went to the library, and I saw chess, and I asked my mother, can I play? And she said, sure. And I played, and I was like, this is the way out. And as soon as that, I didn't think about the pain anymore, and I just thought about chess, and the pain just wiped my mind. But the pain still happens every once in a while, sometimes. But the feeling is, it's like a scrape. It's like, say somebody had long nails, and they scrape their nails against a whiteboard, against a blackboard, and you hear a screeching sound. It feels like that inside of you, and it hurts, and yeah.
Great job.
Thank
you. Very strong, okay? Keep it up.
And his proud mom, Ms. Price.
Hi, everyone. Thank you for having this. I do appreciate that. Hearing Samuel speak, my name is Annette Price, but hearing Samuel speak, as parents in the room, it does bring tears to your eyes because you are not able to avoid the pain for your child. And as he said, it's excruciating pain that you can never imagine, and you don't know how to fix it except take him to the hospital. And the hospital workers sometimes don't know what to do either. And they're also hospitalized for quite some time. We have many doctor's visits. We have many pulmonary doctor's visits and a lot of specialists that we have to see on a regular basis. Right now, we're at 3 months visits every 3 months because he's on the hydroxyurea, which definitely helps him. However, I do feel that now that he's getting older, he's going to go through puberty, I'm not sure how effective it will be. So we are hopeful that there will be a cure soon, very, very soon. So again, thank you for having us.
Shamanika, I've known Shamanika since she's in 3rd grade. And what I do for sickle cell is because I took care of a lot of patients in the hospital, but because I got to witness and be part of her life and her inspiration about how she's overcoming it and totally dedicated to others. Shamanika.
Thank you, and thank you, Mrs. Trump, for having us. I'm very excited to be here. As Admiral Jawar said, my name is Shamanika, and I have sickle cell SS, and my mom has known that I've had sickle cell since I was 6 weeks old. I had my first stroke when I was 3 years old. And I had my second stroke last year at the age of 30. So as Kayla said, one of the hardest parts of having sickle cell is it's an invisible illness. Like, look at us, we're all beautiful people, we all look amazing, but chances are at least 2 of us are in pain right now. Sickle cell has always been a part of my life. It's always affected my life. Just like Samuel, I spent my 2nd grade year in the hospital on Christmas, and I was really sad about missing Christmas, but children's hospitals have a way of making the experience a little better, so I got a lot of gifts too, Samuel, when I was there on Christmas. And when I was 16, I spent Christmas in the hospital again. I've missed many birthdays in the hospital, many other holidays. Just like Kayla, I've missed experiences. Sickle cell is that constant reminder that it's not going anywhere. That's why it's so important that we need more curative options, more medications, more funding. I'm thankful that hydroxyurea works for me. So I'm letting you know, Mom, I've been on it since 16. It still helps after puberty for me. And I'm excited to have your time and to be in front of you. I know that your campaign is the Be Best campaign, and you're really passionate about children and bullying and the well-being of children. But me, as an adult living with sickle cell, I've lived both worlds. I've lived in the pediatric world where you're completely catered to, you're not disbelieved. It's like we're like little princes and princesses when we're in the hospital as kids. But when I got to college and the different stress, and then you have a doctor tell you to your face, I don't think you're in pain. I think you just want pain medicine. That also ties into your opioid abuse initiative as well. Sickle cell patients, as adults, we become bullied by the medical system, the healthcare system, by uneducated doctors, and we're also victims of the opioid crisis because we are a minority illness. As Jerron shared, 1 in 365 Black people have sickle cell, and 1 in, I forgot the exact number for Hispanic, but the most people in America, here in America, are Black people and Hispanic people with sickle cell. And when we present to the ER, oftentimes we are met with disbelief, with doctors not wanting to give us the medications that we need, and it leaves us there to suffer. It leaves us there questioning, why are these people treating me so badly when I came here for help? And that's why I'm so passionate as a sickle cell warrior, because I don't want Samuel to grow up and be in the hospital and a doctor tells him that he's not in pain. So our children, I'm so grateful for pediatricians because they do so well for our children, but once we become adults, we're kind of forgotten about and we're kicked out into the adult world and we have to fend for ourselves. Kayla, I'm gonna be a little honest, I'm a little jealous that you're 21 and still get to go to pediatric hospital. But I'm actually grateful that I have sickle cell. I've never seen it as a curse. I've only seen it as a motivator because every day I have something to prove to myself and I have something to overcome every day. And that's what encourages me to continually speak up for people living with sickle cell, because everyone with this illness isn't as vocal as me. Everyone with this illness doesn't have Admiral Giroir as their godparent. Everyone is not that fortunate. And I didn't grow up fortunate. I grew up in public housing in Dallas, Texas, a single mother who raised me all by herself. And I'm just proud of the hard work that my mom put into me. And I'm proud and thankful of the Giroir family for being with me since 3rd grade. They've been through every milestone with me, every sickness scare with me since 3rd grade. And it's a big reason why I am in front of you today, and I'm so able to speak up for us because it's needed. And I would love it if you could become our ally and make this cause your cause as well, because as a woman who hates bullying, stick up for us who are often bullied by the healthcare system.
Thank you, Shamanika.
So thank you.
Thank you very much for your story and for your strength. That's why we are here today, so we could help children and adults. Thank you so much. We are here, all of us, doctors, advocates, so we are working on that.
Thank you. And then finally, Jared Brewer, followed by his dad, Mr. Jack Brewer.
Hello, my name is Jared Brewer. I'm pleased to be with you all today. Thank you, Mr. Trump, for having us. So I was I was diagnosed with sickle cell at birth. I had 2 parents that both had the trait, and that being said, it was a good experience to know that I was able to actually be taken care of at a young age due to the fact that I was diagnosed with sickle cell at birth. So that being said, I had realized that I always wanted to be like my dad. And my dad, growing up, my dad played football, and he lived a life that I very, very much looked up to. So that being said, I realized that I couldn't do exactly the things that my dad could do because of my abilities and experience with sickle cell, but it actually led to another blessing. I found a passion of mine in music that I actually could reach out to other people about and, get my message with sickle cell and actually let them know that, hey, with sickle cell, yes, it is something that can hold you back, but it's also something that, if educated properly, you can be well off to succeed in a situation where you can actually be educated. And when you are educated, the more educated you are about sickle cell, the easier it is to deal with the situations when they come up. So that being said, I just really wanted to share my story, and because I really, the thing that made me embrace my sickle cell was this time last year, I was having a lot of problems with sickle cell. I was in very much pain. I was excruciating pain. So I was just thinking to myself, like, something has to change. Something has to change with this. So what I did was I changed my diet, and I was eating I was just eating how I wanted to eat, just eating for pleasure. What I did was I stopped eating meat completely, and I just totally changed pescatarian with the pescatarian, and I just started eating way more healthier, started promoting just healthy living, and I started actually feeling way better, and I haven't had one crisis since I stopped eating meat. And I just felt like I had to share this story here today because I feel like a lot of problems that are directly correlated with sickle cell can be fixed with a diet that can be very, very nutritional to someone that can actually increase their diet with education. So I really just want to be here and come here as somebody that actually can say that I really am grateful that I had sickle cell, because it actually led me to live a life that is promoted by health and actually just driven by living good and eating good and living a great life.
We're going to recruit you to the President's Council on Sports, Fitness, and Nutrition, okay? That's in my office, too, so we know where you are now. We're going to get you part of that. Mr. Brewer?
First Lady Trump, Admiral, ladies and gentlemen, that would help. First Lady Trump, Admiral, ladies and gentlemen, it's truly an honor to be here. When I hear my son speak and I hear your stories, it's hard for me to hold back my emotions. Because when my son tells you the story of growing up watching his father play in front of 60, 70,000 people on Sundays, knowing that he has sickle cell, that's a reality that most of us have never experienced. For me, I didn't even understand what having a sickle cell trait meant until my son was born. And so I played professional football, played and went to the best doctors in the world. But no one ever gave me the answer to why every time I overheated, I broke out in severe cramps. No one ever gave me the answer to why I was the only one in the locker room after every hot practice getting 2 quarts of IV. And so the dangers that go into this, and I'm someone who's playing in the National Football League. And so only imagine all these little kids and all these parents and all these people who are dealing with this disease that no one has ever been their voice. Well, Jerron, I want to thank you, brother, because what you do here at this White House and the way you put in the forefront issues that affect African-American people, you need to be praised for it. And I thank God for you. First Lady, the way that you stand up for the rights of children and the way this administration continues to put on the forefront the issues affecting black people. Let's be honest now. There's black kids just like my brother Samuel that are hurting. Why did it take from 83 to now for someone to start being their voice? Come on, America. Come on. We got people that are hurting. It's time to actually put action forward and stop just talking about things and having all these political discussions. People like my son and so many others need America to come together. And thank you, Admiral, and thank everybody in this room for being the voice for kids just like my own. God bless you.
Thank you so much, Mr. Brewer. We have 2 other very special people to make a couple of comments. Dr. Andrew Campbell, incredibly inspired by him, runs the Sickle Cell Center at Children's National Medical Center.
First, I'd like to thank the First Lady for Trump for using your platform for sickle cell disease. It's very inspirational. As you can hear from all the families, sickle cell disease affect everyone differently. It talks about diet in terms of treatment, hydroxyurea, but one thing I would like to highlight is two things. One, that sickle cell disease begins in infancy. Babies can have pain at that time, and it can continue throughout life. And we need more disease-modifying treatments for our patients. We like Samuel and a lot of our children to have more, not only affordable and more access to new treatments, but also more access to curative treatments, such as the CURE initiative by the NIH. And right now it affects 100,000 individuals in the United States, but what's happening is that a lot of our kids are growing up, and we would like to offer them treatments that will allow them to live more fruitful lives as an adult, more productive lives as an adult, allows them to go to college, allow them to work with free of pain, free of organ damage, because sickle cell disease can affect your life expectancy. It can up to 40 to 50 years of age. So I feel that we have a long way to go, but at the same time, I am also happy that Admiral Durar, Admiral Felicia Collins, David Wong, and everyone here have put forward initiatives such as the National Academy of Sciences blueprint addressing for sickle cell disease. We're very excited about that. Also, the Sickle Cell Treatment Act of 2018. We hope that we add more money and appropriations for sickle cell disease moving forward. And I think hearing all of our families, we are very inspired as a healthcare provider. Thank you.
And then a very special person, last but certainly not least, and we all know you, and our hearts go out to you and your family on behalf of your brother, Ashley Valentine.
Thank you. My name is Ashley Valentine. I'm co-founder and president of a sickle cell advocacy organization called Sickle. And Sickle is co-founded by myself and my older brother, Marcus. And thank you for your condolences. My brother, Marcus, passed away on June 22nd. He was 36 years old with sickle cell disease. His vision for Sickle was we got to get the story out there because, as we mentioned, sickle cell is an invisible disease, but our community is suffering. We talk about the progress we made here, and this is historic to be speaking to officials at this level because the reality is we suffer. We suffer every day. What you see here is not what happens in our households. So we go out into the community and we interview sickle cell patients and we put their stories next to their faces. Because what you don't see is in order to get Marcus to a conference, he had to go to his cardiologist, he had to go to his pulmonologist, he had to go to his respiratory therapist, he had to get blood draws, blood gas, he had to take an enormous amounts of pain medications because the reality was up until last year we didn't have treatment options. So our pure goal is to make sure that the patient voice is heard and that it's clear so that we can eliminate stigma and improve the quality of life for people living with sickle cell disease. So a little bit about my family. My brother Marcus was 36 years old. He had sickle cell disease, hemoglobin SS, and he had a pretty severe form of sickle cell disease. But our story starts way before that. Both of my parents have sickle cell trait, but my dad was tested 2 times and told that he did not have sickle cell trait. My oldest brother does not have sickle cell trait, and I don't have sickle cell trait either. They didn't know that they were carriers until Marcus was born. Unfortunately, that's a norm. Many people have sickle cell trait and do not know they have sickle cell trait until they have a baby with sickle cell disease. So our household was full of joy, but we really tried to live in between the crises. And what that means is we would play violin in the city of Chicago because we were next to the Children's Hospital. And the Children's Hospital was so much fun. I was the princess of the playroom. I would make pottery, and I would get to meet celebrities. But what was happening in the next room was that Marcus was being put on ventilators because sickle cells were clogging his lungs and putting him into acute chest syndrome. Or he was having to get blood transfusions or blood exchanges as an infant or a toddler because his hemoglobin would rapidly drop to a 4. Fortunately, he was put onto hydroxyurea, and that brought his hemoglobin from a 6 to a 7, and he didn't respond well to hydroxyurea. In 2015, Marcus developed sepsis, and he was very sick. He spent 6 weeks into the hospital, and I was called home because my mom said he might not make it. You have to come home. And during that hospitalization, we saw infectious disease specialist. He was in ICU. We saw every single doctor under the sun. The sepsis had broken down his bones, and it caused him to have avascular necrosis in both hips. So he was on his way to get hip transplants. And many people with sickle cell will tell you that they've had their hips replaced. During that hospitalization, after all of that, he was still accused of being a drug addict. During that 2015, he looked at me and he said, something has to change. Something has to change because we need to be seen as individuals that need help. We need to be seen as a community that has been forgotten, that has been discriminated against because of the color of our skin. And adults need to be, we need to remember our adults with sickle cell disease. Our children, if we can mitigate the disease in childhood, then when children become 25, 30 years old, maybe they won't have as much pain as my brother had living all these years. On top of the physical pain, financially, sickle cell devastated my family, but we've survived. Our house has been foreclosed 3 times. I've lost my job once. My mom has had $0 paychecks working for the federal government because all of her paychecks were going towards the insurance. My dad has accepted layoffs because he needed to take Marcus back and forth to the hospital. And employers, quite frankly, don't understand or care about sickle cell. So when you say, my family member has sickle cell, they tell you, well, someone I know had cancer, maybe they'll get better. And the reality is we live with this every day. So I'm here today asking for awareness, and thank you so much for allowing us to be here. We have 4 new drugs to market right now, and we're excited. We're so excited, but patients still can't access them. My brother was enrolled in the free drug program because insurance denied the brand new treatment for him, and my mom still had to take off a day of work in order to work with the company to get him enrolled in the free drug program. My brother was on hydroxyurea, he was on Indari, he was on Voxelotor, and he was just about to start Adakveo the day he passed away. We had to fight with insurance for every single one of those new treatments because they denied us. Outside of the new treatments, they didn't understand his other conditions, so it was important that we advocated as a family. So the work that you've done out of the Office of Minority Health, and thank you, Admiral Gerard, is monumental for sickle cell, but we need to make sure that the conversation here makes it to the patient population, and the urgency is real because our friends are dying from this disease. Thank you.
Thank you, Ms. Ashley, and sorry, my deepest sympathy for your loss, and thank you for advocating. Very important. So, before we start discussion, I would like to ask Ms. Rollins if you would like to say a few words.
Thank you, Mrs. Trump. Ashley, I think your brother would be so proud of you, and he's probably looking down right now. So congratulations and well done on making sure his legacy continues. It's such an honor to be with all of you. My name is Brooke Rollins. I am President Trump's Chief Domestic Policy Advisor, which means I run his domestic agenda, everything from health care to education to criminal justice reform to transportation to infrastructure, all across the board. And I will tell you this, I'm so moved by all of you today. You truly are heroes, and so grateful for your time and your effort to come here and be with us and to tell your story. This president, from day one, has said he's fighting for all Americans, but more than any other, he's fighting for the forgotten American. Men and women and children who previously maybe didn't have a shot at the American dream and maybe didn't have a shot at a good education or a great healthcare system, that he would fight every single day with Mrs. Trump standing beside him, with all of our team alongside them to make sure that you are forgotten no more. So it is an honor to be with you, and please know that everything we do every day is to fight for you all and to fight for what is right and true for this country and to ensure that no one is left behind. Samuel, you are an inspiration. What a gift to have you here. Someday you're going to tell your grandkids about coming to the White House, and hopefully the sickle cell disease and everything that all of you have suffered and your family have suffered at that point will be no more, because we will never stop fighting for you. So thank you, Mrs. Trump. Thank you. Your beautiful, amazing leadership is truly inspiring. Thank you.
Thank you.
Samuel may be working in the White House, maybe behind the Oval Office by that
It
time.
could be President Price, Admiral Giroir, really.
Thank you, Brooke. Dr. Gibbons?
Thank you, First Lady Trump, for creating this platform. I've just been inspired by the voices around the table, people of lived experience with sickle cell that can say so much more articulately than those of us who are considered experts. They're the real experts. They're the focus of this. I hear that we've made some progress. Research has led to 4 drugs that are FDA approved in the last 5 years. But I also hear that we have a lot more work to do. We have to do better at controlling pain without opioids. We've got to do better about preventing these crises. We've got to do better even in our science of delivery, figuring out how to make transitions from pediatric to the adulthood. We've got to do better at taking what we know works and making sure everybody gets it. Drugs like hydroxyurea. We've got to do better about what we can do for all the sickle cell patients throughout the world. And 50% of children in sub-Saharan Africa shouldn't be dying before age 5. We can do better. And we are encouraged that we think curative therapies are within grasp, so that no child born with sickle cell should worry about having a stroke at age 3. We feel inspired by your leadership in putting this forward, as well as that of Admiral Giroir. We're committed to working through the National Academy of Science plan and making it happen. Thank you.
Thank you, Doctor, and thank you for all what you do. Thank you. Admiral Collins, please.
Good afternoon, everyone, and thank you so much, Mrs. Trump, for your leadership, your care, your passion for children. It's really an honor for me also to be here with all of you here. I often use the expression when I think about communities of color, and I often talk about the inner strength that we have. And so, without a doubt, Kayla and Shamanika and Samuel and Jared, you all have demonstrated inner strength in a way in a way that is just so remarkable. And so I am so honored to be here with you all and to hear your stories and to be part of the team at the Department of Health and Human Services under Admiral Giroir's leadership, with my colleagues Dr. Gibbons, with Captain David Wong, who is our chief person that does all things sickle cell. I'm honored to be here with you, and I commit to you that we will continue the work that has begun. We commit to you that we are very fortunate to have this National Academies report that gives us some very concrete language, Mrs. Trump, and helps to guide things that we can do. My team knows that I'm one that often talks about give me something concrete, what can we do? I can't remember who spoke, but someone talked about, maybe it was you, Mr. Brewer, about needing action. And so you all have inspired me, and we promise and commit to going forward and to taking action so that the pain and the challenges that you and your families experience will not continue forever. So thank you so much, First Lady.
Thank you, Admiral. Thank you. Would you like to say a few words, Admiral? Or
Thank you again, Mrs. Trump. Brooke, my office is dedicated to eliminating health disparities in the country, to give everybody an opportunity for equal health. When President Trump nominated me to this position, Took me a while to get confirmed, but I knew that one thing we were going to do would be working for people with sickle cell. Because you're 100,000, you have a couple million with trait. But also, if we can't improve sickle cell, we can't improve anything. We know who you are. We know your diagnosis. We know everything. We just got to do it. We need to take action. And that's why I want to thank you again for giving us the opportunity to take action and to impact people's lives. That's why we're here. And again, I want to commit to everyone around this table that this administration, you'll never be last in line, and we're not just going to talk words. We're going to walk the walk. We're going to make the action. I'd rather make the actions and speak very softly than the other way around. But never forget, we may not be talking, but we're doing, and we're thinking about all of you every day.
Thank you very much, Admiral, for being here today and for all your work you're doing. And thank you to everyone here for sharing your stories. Your words are powerful. I know they will lead to awareness and to action. As we continue to observe National Sickle Cell Disease Awareness Month, I want to recognize the bravery of those living with this disease, especially children and adults, of course. You deserve a long and happy life, free from pain, and we will continue to fight until nothing stands between you and your dreams. As we offer our gratitude and support to the families, caregivers, and advocates who provide comfort and care, even when their own hearts are breaking. While we use this month to raise awareness about the fight against sickle cell disease, the work will continue after September has ended, for as long as it takes to find a cure. Thank you very much again for being here. God bless you and your families. Thank you.
First Lady, would you mind if I say a prayer before we leave?
We'd love to.
Dear God, I just want to say thank you as we all come here together. I want to ask for your grace over the First Lady, over the Admiral, over Brooke, over Jerron, and everyone else in this White House, dear God. We just ask for your blessings and to bring healing upon so many kids and adults around our nation who suffer from sickle cell. Dear God, just give us all strength and give us all the anointing to continue to work hard on behalf of those who don't have a voice. Dear God, and we just want to say thank you for allowing us to live in the greatest country on earth and continue to give us strength to come together as we fight for so many who need us. Dear God, just thank you for everything that you've done for us, and we give you all the glory and all the honor and all the praise in Jesus' name. Amen.